welcome to this week's Wellness Webcast. I am Mo Wolf, CEO of Little Honeys LLC, the makers of Bee Rescued Propolis Care and Bee Energized Raw Bee Pollen products. This is the Wellness Webcast, where we talk about all things health, wellness, and beautiful living. Also, we'll take your questions about honeybees if you'd like. I know that the honeybees have been in the news a lot lately. They're actually the cover story of Time magazine. And there's also been on some European newspapers, there's been some rumblings from the Russians about the use of GM interaction with the honeybee, and so she's a hot topic right now. But we're going to be talking about, we'll save that for another day. Probably next week we'll probably talk about honeybees in the news, see how some of these headlines develop before we start taking them apart bit by bit. This is the fastest half hour on the internet, and I thank you for joining us. I have with me right now, joined by, in the office, we don't have a studio, it's the office, joined in the office right now by Mr. Norman Sadler, the official program observer, keeps me on a short leash. He's got a taser over there and will shoot me if I get off track, and you'll know because I'll go, also have Julius standing by to take your phone calls. So if you would like to be a part of the show, give us a call at 1-855-679 the word life. And if you are dyslexic, like so many of my relatives, well, no, they're just illiterate. If you want to be a part of the program, now all of my relatives are going to send me sassy grams. If you want to be a part of the program, give us a call, 1-855-679 the word life or 5433. That is a toll-free number. Doesn't matter if you're east of the Rockies or west of the Rockies. It's just call us. Give us a call. We'd love to hear from you. And Julius will be answering the phone, so when you do call, say, "Hey, Julius." So please give us a call. I'm sorry, I'm a little distracted. Julius is texting me here and putting in her 2 cents worth. So this week we are talking about alternative medicine. Now, as many of you know, I am a practitioner of Oriental medicine, actually finishing up med school for that right now, Oriental Medical School, and absolutely loving it. But some of the feedback we've been getting from folks is, how can we better understand the alternative medical field? Where does it become useful? Where does it overlap with more of a traditional Western therapies? So we want to talk about that a little bit today. We want to explore those options, explore where we're at. Now, unless you've been living in a refrigerator box with no outlet to society anywhere, and that refrigerator box is, I don't know, in the cleft of a rock up on Trapper Peak in Montana, well, even there they've got trails that people come up. Unless you're living in a refrigerator box in some remote outpost of the Ural Mountains, you've probably heard by now that the United States has a healthcare crisis. At least that's what they're calling it. There have been problems with the American healthcare system that have been intrinsic for several decades that have just become worse and worse, and prices have gone higher and higher, and now we've made a political issue out of it. But regardless, there's a problem. And so where we see the relief coming in is not some political mandate. Where we see the relief coming in is through people broadening the system, making that provider, making that pool of providers bigger. I enter Exhibit A, U.S. News and World Report. This was an article on, I think it was 2012, 2011, Friday, August 26th, by a gentleman by the name of Alan Moses. Moses. Alan is the Health Day reporter, U.S. News and World Report. Alan writes in an article titled, "Many healthcare workers have turned to alternative medicine. Their use of everything from herbals to massage exceeds that of the general public, research suggests." Well, good old Alan writes, 3 out of every 4 U.S. healthcare workers use some form of complementary or alternative medicine or practice to help them stay healthy, a new report shows. What's more, doctors, nurses, and their assistants, health technicians, healthcare administrators were more likely than the general public to use any number of wide-ranging alternative medicine options. In a 2007 poll of the National Health... Maybe I'm like my relatives. I can't read this morning. In a 2007 poll from the National Health Interview Survey, they sampled over 14,000 working adults 18 years and older, and about 1,300 of those surveyed were healthcare providers. These folks worked either in hospitals or in some sort of an ambulatory care service. The survey covered 36 different forms of options, including therapies involving body manipulation, mind-body, biological-based therapies, and energy healing treatments. Doctors and nurses, now this is what's fascinating. So much of the time we hear about doctors and nurses poo-pooing any sort of natural or alternative healthcare modality, saying, well, it's not founded in science. And it's amazing how many of these people develop a British accent just to say that. It doesn't sound right unless you have the British accent. So you've got this culture that so much of the time harkens back to good old Dr. Morris Fishbein, the head of the AMA back in the 50s and 60s, who was on a total, well, if he could have been frothing at the mouth, he would have, about chiropractics. He hated them, and it was dirty, some of the stuff that they were pulling. But so much of the culture in Western medicine harkens back to that when you start talking to your doctor about an alternative form of therapy. But according to the data, it suggests that 75%, 3 out of 4, 75% of American healthcare workers are seeking this kind of therapy. In fact, doctors and nurses were found to be more than twice as likely as non-clinical healthcare support workers to have tried out a practitioner-based complementary or alternative medicine, such as chiropractic or acupuncture, in the past year. 76% of healthcare workers say they have used such methods in the past year, compared to 63% of people working in non-healthcare fields. The reasons that these healthcare workers are turning to these alternative medicines, now get this. Bear this in mind for those of you who are dealing with a bad back, and you've gone into your doctor and he says, "Oh, we gonna refer you to the surgeon. You're gonna have a laminectomy. We're gonna do all manner of digging and cutting on your back here." For those of you who are told, yeah, you're going to need a knee replacement surgery. Those of you who are told you're going to need rotator surgery. For those of you that are told any kinds of these problems, I want you to listen closely. And according to Alan Moses, according to Alan of the U.S. News and World Report, citing the 2007 poll of the National Health Interview Survey, the reasons that these 75% of healthcare workers are turning to alternative medicine primarily for the three biggest concerns were back pain, neck pain, joint pain. That's why they're turning to these modalities. So, why are they turning to these modalities? Because they work. Because these healthcare practitioners know, yeah, my alternative is to go under the knife and get cut. My alternative is major surgery here. I don't want to do that, because once you go that route, you can never go back. I'm going to try one of these alternative medicines. And they go to a chiropractor, they go to an acupuncturist, they go to a structural elements practitioner, they go to any number of these different modalities, and they find out it worked. I don't have the back pain issues that I have. My neck don't have the thoracic outlet syndrome anymore. So what we have is a nation who is got some issues with its healthcare system. Our healthcare system, we as Americans spend more money on healthcare than anyone else in the world. We've got medications that cost a fortune a day, let alone a fortune a month. Talking to a gentleman within the last couple of weeks here in the clinic about his sexual dysfunction treatments, hypofunction, and his doctor prescribed him Cialis. Well, those pills are stinking expensive. They're like $50 a pill. What on earth? There's some treatments, acupuncture treatments, some herbal therapy. We're able to get him back on track, and it doesn't cost him $50 a pop. Costs him the acupuncture treatments, a series of just a few of them. Costs him some herbs, and then he's done. That's pretty incredible. The difference is, instead of just intervening and trying to help maintain, these alternative modalities are going to the root source, and they're trying to fix the underlying problem that's causing the presenting symptom. Which makes a whole lot more sense than, oh, you're coming in here today, you've got a sinus infection. Well, instead of just getting you the appropriate antibiotic and clearing it out completely so that you can breathe better and feel better, how would you like it if we just maintained the level of misery that you're at right now? That wouldn't make sense, would it? You go into your doctor with a sinus infection, you say, cure me. So the doctor gives you the antibiotic. Within a few days, you're going, I can breathe at last. And that's what you expect. But for so many of these other problems, say this gentleman's dysfunction, his hypofunction, we're okay with, yeah, just don't worry about the underlying problems. Just give me something that'll fix this symptom occasionally when I need to have it fixed. March 10th, 2013, CNN posted an article called U.S. Manages Disease, Not Health, and it's by Andrew Weil. You know who Andrew Weil is, don't you? Mr. Sadler shaking his head no. Andrew Weil is the author of You Can't Afford to Get Sick, Your Guide to Optimum Health and Healthcare. Still don't know who he is. This is how I know Mr. Weil. Andrew Weil is the guy with the really, really good beard. Okay, now Mr. Sadler is shaking his head. Okay. He's the guy that's got the really good beard. When I look at him, I think of Hamlet's father. Okay. Now we know who Mr. Weil is. Andrew Weil, the guy with the beard, the great beard. When I'm your age, sir, I hope I can grow a beard like that, or half that good. Andrew Wild writes, I have argued for years that we do not have a healthcare system in America. We have a disease management system, one that depends on ruinously expensive drugs and surgeries that treat health conditions after they manifest, rather than giving our citizens simple diet, lifestyle, and therapeutic tools to keep them healthy. This is what we're talking about. Western medicine, I'm thankful for it. It's bailed me out personally. It's bailed my family out personally. It's a gift of God. Western medicine is reactive. When you've got a very acute, dangerous situation, get thee to a hospital. There's another Shakespeare reference. How about that? Except we changed nunnery to a hospital. And that's Hamlet, too. Wow, I'm on a roll. People are going to think I'm literate. Little do they know. My notes are written in crayon. I've embarrassed my mother. I've embarrassed Mr. Sadler. I've embarrassed my family. I've let out the family secret of illiteracy. Did you catch that, what Mr. Weil said? He said that this disease management system that we have treats healthcare conditions after they manifest. Now, let me give you a little history lesson here. Back in the old days, back years ago in China, when the emperors were around, and they had their different warlords and everything else, and they would pay their doctors not to make them well, not to make them feel better and get over sickness. Listen to this. This will blow your mind. They were paying their doctors to keep them from getting sick. Now, granted, sometimes there was a high mortality rate for these doctors who weren't very successful in keeping the emperor healthy. The emperor would get sick and off with his head. We're painting the roses red. I'm sorry I had to do that. Stick to this. I am sticking to the subject, Julius. Pressures. I got pressures. Julius, Mr. Sadler, they're here to keep me on a short leash. Fine job you're doing, too. So you had these doctors that were paid to keep the emperors well. If the emperor got sick, off with his head, he was done. Well, the idea was to regular treatment, regular and analysis of diet, regular analysis of physiology, physical exam, to make sure that there wasn't a problem developing. If a problem developed, we got problems. So, don't you think maybe we ought to start taking a page from Chinese history? And there's a lot of pages, but let's stick to this page because some of them don't you think maybe we should consider our physicians and hold them to a higher standard of keep me well? Right now, part of the problem in the United States, you read some of the information coming out that's being published, and the doctors are complaining left and right about being overloaded with patients. I don't have time to spend time with my patients. I got to go in there, make the decision of diagnosis, and get out of there and write the prescriptions. Well, wait a minute. Whoa, back off. Maybe we need to start, as doctors, maybe they need to start limiting their practice. Maybe. Maybe we need to start focusing more on patient care than on keeping the administrators happy. Maybe the administrators should be focusing more on quality and reminding themselves and their staff that medicine is a service being offered. Ooh, a service industry. You've heard me before talk about doctors and medicine, and if you've got a problem with your doctor and they aren't listening to you, or they aren't treating you the way that you feel you should be treated, then find a different doc. We as Americans are have this culture of treating the disease after it's manifested, rather than trying to take care of it ahead of time. Now, yes, patient overload. You go to the ER, boy, just about any given night, and you'll sit there and there'll be people coming in with sprained ankles. You'll be sitting there, people will be coming in with all manner of things that, yeah, it's very acute, very painful, but do they really need to be in an emergency room? Is there another option? Well, some of these alternative medicines, I know with traditional Chinese medicine, you're trained to be able to treat acute sprained ankles. You're trained to treat acute skeletal muscle issues. You're trained to treat some pretty acute internal medical issues as well. So if we broaden the scope of the providers that are out there, and we change the culture to include some of these alternative medicines that 75% of healthcare practitioners are seeing right now, and we start putting them out there as more of a mainstream, we're going to start taking pressure off of these medical doctors. Did you know how long it takes? Mr. Sadler, I bet you didn't know this. Did you know how long the average time is between an MD walking into the room and the time between walking in and making his diagnosis? Any guesses? Any guesses? Studies have shown that it averages 18 seconds. 18 seconds before the doctor walks into the room, looks at you, and makes a diagnosis of what's wrong with you. I can't even tie my shoes in 18 seconds. How are you going to make an informed decision to be able to prescribe some pretty scary substances to somebody in 18 seconds? You can't. Well, we're overworked. We're overworked. Well, in Milwaukee, there's an interesting experiment that's coming underway. I want to say it's over by the University Parkside in Milwaukee, that area, where they are opening up something like an urgent care type facility. But instead of going in and the first person you see being an MD, you see will be a practitioner of traditional Chinese medicine. And that practitioner will, excuse me, cough button, cough button. That person will assess you and determine, is this something I can treat? Is this something that we can just have a nurse look at? Or is this something that we need to bring the MD in on? That triage is showing in all of the samples and models and experiments that they've run, the trials that they've run so far, it's showing that they're allowing the doctor, the MD, to actually work on issues that the doctor should be working on, as opposed to issues that are just sucking up the doctor's time. The patients are getting good, comprehensive care. The patients are getting great results. And the doctors are actually getting to practice the art and science of their medicine that they've trained for. I'd say that's pretty fantastic. Now, well, wait a second. Let me get that back here. I had one more. I threw it away too early. Lesson learned here. Don't throw your trash away too early. You might need it. According to what can, we've got all of this. There's acupunctures all over the country. If you need socks darned, we're pretty good with needles. What can acupuncture treat? That's just one of many. Alternative medicines. You've got chiropractic. You've got acupuncture. You've got herbal therapies. You've got all kinds of stuff. Well, what can acupuncturists treat? Well, according to the World Health Organization, and this is by no means an exhaustive list. Okay, this is just an excerpt taken from the World Health Organization. Who, and that's not the band. Their name is copyrighted. I'm assuming World Health Organization's name is too, but no matter. We're going to use it anyway. According to WHO, the World Health Organization, and that's not an owl, that's not a bird, they recognize the ability of acupuncture to treat the following diseases. Are you ready? They recognize acupuncture to have the ability to treat asthma, menstrual cramps, arthritis, sciatica, TMJ, allergies, anxiety, depression, bladder problems, kidney problems, childhood illnesses, cold, flu, cough, bronchitis, constipation, diarrhea, dizziness, ear, nose, and throat disorders, fatigue, gynecological disorders, genital herpes, herpetic neuralgia, heart palpitations, immune system deficiencies, infertility, insomnia, numbness, poor circulation, PMS, sexual dysfunction, impotence, skin problems, stress-related illnesses, weight gain, weight loss, and the list goes on, and I can throw it away now. If you can go to an acupuncturist and get good, competent treatment for these things, that would take away a lot of that patient overload for the GPs, the MDs. They would be able to start seeing their patients and make their diagnosis taking a lot more than 18 seconds. Gone are the days where you go into your doctor and they sit with you for half hour, 45 minutes on follow-up treatments. Follow-up visits, not initial intakes. Initial intakes take time, but we're talking the follow-up visits. Gone are those days. In fact, it's very rare to have a doctor that actually puts his hands on the patient and palpates and listens, and the art of medicine is almost a lost art. Thank goodness for the doctor here in town that Dad and I saw, and he worked on Dad a couple weeks ago. I told you about him last week. Very, very exciting to watch. But those guys are few and far between. And they always cite, well, we're overloaded. Well, here's an option for you. As patients, why don't you make the decision? If you've got an issue like any of these that we listed here, if you've got a bad sprain, if you've got joint pain, neck pain, back pain, instead of going to your MD, why don't you go to your trained acupuncturist, Chinese medical professional? These guys are trained to recognize red flags. These guys know what to look for. These guys are competent enough to refer out if they see a problem, and they do. That's one of the big things that we're trained on. One of the main things we're trained on is what not to treat, because there's so many things that you can treat. But what can you not treat? What should you refer out? What's an emergency situation that needs some real intervention? And then once you're brought to that area of wellness, what has to be done to maintain that wellness? These are some things to think about. So these are some wonderful things to be considering next time you've got a health question. you might just take me up on that challenge of contacting an alternative practitioner. The music's up. Fastest 30 minutes on the internet. I want to thank you for joining us on behalf of all of us here at Little Honeys. Be rescued and be energized. Thank you for joining us. This week, be well. We'll see you next week, folks.